Hi everyone. Up until just a few years ago, there were no medications designed specifically for postpartum depression. Think about that. We've had antidepressants for decades, but nothing created for one of the most common and devastating types of depression that affects new mothers. Postpartum depression isn't the same as other depressions, and it's not always what people think it is. It's not just the first few days or weeks after you have your baby and come home. It's different, it's complex, and it deserves its own conversation. And that's what I want to talk about today, because people think that it's just the crying or not being able to get out of bed. It's not just the baby blues. It's not a rough couple of days where you just cry and then you bounce back. It's a condition that can strip joy out of what should be some of the most meaningful moments of someone's life. And for too many women and families, it's a silent emergency. Maybe you've imagined before what it would be like to have your own baby. Or maybe you've struggled with infertility for years and the moment finally comes. But instead of joy, you look at your newborn and feel nothing. Or worse, you feel like you're staring at a stranger. Women with PPD feel like their children don't even belong to them, that they have no connection to them, and that they just simply cannot care for them. And that absence of connection can be terrifying. It makes women question their worth as mothers and their very identity, their overall identity. Postpartum depression can spiral into psychosis. The sun is so bright. Oh my goodness. Postpartum depression is one of the loneliest illnesses in psychiatry, because everyone around you is celebrating, telling you how lucky you are, how beautiful the baby is, how you should be glowing. Meanwhile, you're barely holding it together. You feel broken, misunderstood, and unseen. And then because of the stigma, many women don't even tell anyone what's happening. And if they do, they're often just brushed off. Those crows, they want me to feed them. They're brushed off. It's just hormones. You're tired. It'll pass. It'll regulate. But untreated PPD doesn't always just pass. It can linger for months, even years. And it can shape how a woman feels about herself, her child, and even whether she wants more children in the future. Even once the depression lifts, the memory of what happened sticks around. I've had people tell me that they still feel haunted by it years later, by the fact that they couldn't connect with their baby the way they thought they should, or the way they did with their other children, by the same shame of pretending to be okay, or by the guilt of wondering if they've missed the most important first months of their child's life. And that in itself becomes something traumatic. When PPD is treated early, you protect not just the mother's mental health, but also the baby's development and the bond between them. That's why these new medications matter so much. They aren't just about symptom relief. They're about saving relationships, preventing trauma, generational trauma, and giving families the start they deserve. So, when we talk about new medications for postpartum, we're not just talking about pills. We're talking about rewriting the story of what those first days, weeks, and months can look like. For moms, for babies, and for their entire families. Postpartum depression isn't just sadness. It's emptiness, numbness. It's looking at your baby, this tiny human that you thought you would fall in love with instantly, and realizing that the connection just isn't there. And then feeling crushed by the shame of that truth. There are layers of suffering to postpartum that aren't always evident unless you've been through it or are going through it currently. The isolation is tough. Because it's one thing to feel lonely when you're actually alone, but postpartum depression is a special kind of loneliness because you're never actually alone. You're never truly alone, right? You have a baby in your arms or crying in the next room or just depending on you every second for their survival. And still you feel abandoned, invisible, selfish, untethered. And the betrayal is also tough because women describe PPD, describe postpartum depression as a betrayal by their own minds and bodies. Because you dreamed about this moment, like we talked about. You did everything right during pregnancy. And yet, the very thing that was supposed to bring joy has become a trigger for despair. That mismatch between expectation and reality is devastating. I think there's a hummingbird flying around my head. He's hungry too. All these birds are hungry. They want fed. They know where to come. But the guilt runs deep. Women blame themselves. They wonder if their baby feels it too. If the lack of connection is damaging their baby forever. They start to spiral in their heads, in real life. What if I'm not meant to be a mom? What if my child deserves better than me? And there is the lasting impact. Even after the depression fades, scars remain. Some women feel traumatized by the memory of how bad it got. Some avoid future pregnancies because they can't bear the thought of reliving it, which is understandable. Others quietly carry the weight of those first weeks or months, wishing they could rewrite the beginning of their motherhood story. But here's the truth. Postpartum depression doesn't make you a bad mom. It doesn't mean you don't love your baby. It means you were hit by a medical condition at one of the most vulnerable times in your life. And that's why treatment matters. Because no mother should have to fake a smile while suffering in silence. No child should have to miss out on the bond that was supposed to be there. And that brings us here to why this conversation is so urgent. Postpartum depression isn't just another diagnosis. The guilt runs deep. Women blame themselves. They wonder if their baby feels it too. If the lack of connection is damaging them forever. And they start to spiral in their heads. What if I'm not meant to be a mom? What if my child deserves better than me? What if I can't give my child the life they deserve? And there is this lasting impact. Even after the depression fades, the scars are still there. Some women feel traumatized by the memory of how bad it got. Some avoid future pregnancies altogether because they can't bear the thought of reliving it. Others quietly carry the weight of those first weeks or months, wishing they could rewrite the beginning of their motherhood story. The truth is, postpartum depression doesn't make you a bad mom. It doesn't mean you don't love your baby. It means you were hit by a medical condition at one of the most vulnerable times in your life. And that's why treatment matters. Because no mother should have to fake a smile while suffering in silence. No child should have to miss out on the bond that was supposed to already be there. And that brings us here to why this conversation has been and is so urgent. Postpartum depression isn't just another diagnosis. And the sooner we can treat it, and the more we can protect both mothers and babies from lifelong consequences. For decades, postpartum was treated just like any other depression, right? We didn't even differentiate that it was its own condition. And postpartum depression was treated the same as any other depression, with therapy and with antidepressants like SSRIs and SNRIs. And for some women that worked, and it still works sometimes. But for many others, it didn't. Antidepressants like SSRIs can take weeks to work, sometimes months. Imagine being in the darkest, loneliest, most vulnerable place of your life and being told to just hang on, to just wait it out, while you're also trying to take care of a newborn every day and keep both of you alive. And it's not a one-size-fits-all type of issue either. Traditional antidepressants weren't specifically for postpartum depression. They were borrowed from general psychiatry, general medicine, general psychiatry, and applied here. Often without considering the unique biological changes that happen after birth, especially the massive hormonal shifts. Now we can hear a tractor in the background. Can't win. In 2019, we finally saw the first FDA-approved treatment designed specifically for postpartum depression. It's called brexanolone. The brand name is Zurzuvae. It was revolutionary because it worked quickly, sometimes within days. But here's the catch. It had to be given as a 60-hour IV infusion in a hospital setting, or like a certified medical center that distributes it. That meant for the mom to arrange childcare, leave a newborn behind, and rack up tens of thousands of dollars in transportation costs and treatment costs. For most women, it was out of reach. It was inaccessible. Zurzuvae requires a hospital setting because of the potential side effects. It carries the risk for excessive sedation, sudden loss of consciousness, dizziness, and dry mouth. So that's why it necessitates close monitoring, because obviously you aren't going to give someone that and throw them in the car, or give someone that to take home and then you don't know. You know, you want them to be safe. So then we were left in this strange place, because finally a treatment that really worked, but it was locked behind barriers so high that only a fraction of women could actually get it. That's the gap these new medications are trying to fill. But what happens if the postpartum goes untreated? The stakes are far higher than many realize, because it affects not just the mothers, but the babies and the families, potentially for generations. Postpartum affects about 1 in 7 new parents, so about 10 to 15% of mothers. But shockingly, up to half of those depression cases never get reported and they go undiagnosed. And this has the effects on the child development, like we've talked about, because the infants of depressed mothers have been shown to sometimes, can potentially show cognitive delays, such as greater difficulty differentiating between different objects and reduced learning capabilities in general, even after accounting for socioeconomic factors. So that means if you had two children in the exact same circumstances or given the same opportunities, but one had a mother with postpartum and one didn't, the one with postpartum is going to struggle more. They tend to experience things like sleep challenges, emotional dysregulation, and language development issues. Research shows that maternal depression can lead to delays in gross motor skills as well, a higher risk of childhood obesity, behavioral and emotional disorders, and lower IQ scores. One landmark study found that perinatal depression in mothers is associated with increased risk of depressive symptoms and developing other conditions such as ADHD or oppositional behaviors, and then also lower cognitive and emotional outcomes even into adolescence. Untreated postpartum depression can persist. Approximately 38% of women remain depressed 3 years postpartum. Untreated postpartum depression can persist. Approximately 38% of women remain depressed 3 years postpartum. Even when depression fades, many mothers carry trauma, guilt, and fear into future pregnancy. So, half of those cases slip through the cracks. That means that there are countless families who navigate profound pain without recognition, support, or treatment. The babies that have been shown to have trouble sleeping, regulating emotions, and learning sometimes start to show those from as early as infancy. And these challenges can snowball. Language delays, behavioral difficulties, or cognitive gaps that echo into the school years and beyond. The emotional scars often shape how they view themselves as parents, and if they even feel safe becoming a parent again or becoming pregnant again. When we talk about new medications that act faster and are more accessible, we're not just talking about symptom relief. We're talking about changing entire life trajectories for entire families. Because the faster that we can intervene, the faster that we can start to heal any wounds that have already started. This emotional and developmental weight is exactly why the fast-acting, accessible treatments like Zurzuvae or zuranolone represent such a breakthrough. Because they represent an opportunity to bring healing before the damage deepens too much. In August of 2023, the FDA approved the very first oral medication designed specifically for postpartum depression. Finally, the first oral pill that could be taken for postpartum depression specifically. zuranolone, brand name Zurzuvae. For the first time, women can take a pill at home instead of being tied to a 60-hour hospital infusion that they probably can't even receive anyway due to insurance coverage. And for the first time, relief didn't have to take weeks or months. It could come in days. Zuranolone isn't your typical antidepressant. It's a neuroactive steroid, which means it works on the brain differently than SSRIs and SNRIs. Specifically, it acts as a positive allosteric modulator, and it's working at the GABA A receptors. If that sounds complicated, think of it like this. It helps reset the brain's stress and anxiety circuits that get disrupted after childbirth's massive hormonal shifts. This matters because traditional antidepressants don't directly target that hormonal cascade. Zuranolone does. It advertises to be different because it provides fast relief. Instead of waiting 4 to 6 weeks like you would with an SSRI, clinical trials showed women improving within 3 days of starting zuranolone. It's also appealing because it has a short course of treatment. It's only 14 days. It's taken once a day for 14 days, and that's it. Not months or years. 2 weeks of treatment with results that supposedly last beyond the dosing period. And unlike brexanolone, you don't have to check into the hospital, line up childcare, or leave your newborn behind. You don't have to check into the hospital, line up childcare, or leave your newborn behind to go get treatment. You can take it at home, which is a huge step forward for real-world accessibility. But the caveats of Zurzuvae are the side effects. Like any medication, Zurzuvae comes with risks. The most common side effects of zuranolone include sleepiness, dizziness, diarrhea, and fatigue. Because of the risk of sedation, there's a warning about driving or operating machinery while taking it. So you shouldn't drive your car, and that's, that's pretty typical of like any medication. Any medicine, you're going to have some risk, and there's really no great improvement without some side effect. And that's what my older brother always tells me. And the cost of Zurzuvae is high. The sticker price is high, around $16,000 for the full 14-day course. And insurance coverage isn't there yet. It's still spotty, and many families who need it the most face jumping through hoops to get it approved. And then the FDA did include the warning, a black box warning for suicidal thoughts and behaviors, which means prescribers need to monitor closely, especially in women with a history of severe depression. And one of the biggest deal breakers where I'm concerned is the fact that there are uncertainties about safety in breastfeeding and the longer term effects. Because I breastfed my baby, I breastfed my daughter, and I understand now what a big deal that decision is to be able to make. So when you're dealing with something as severe as depression and postpartum depression, you want to be able to choose if you can breastfeed or not. So when you have a medication designed specifically for postpartum, I feel like that's a big deal. Still, even with those limitations, zuranolone represents something powerful, right? Hope. Hope that postpartum depression can be treated quickly, eventually. Hope that mothers don't have to lose months of their lives waiting for connection to return. And hope that babies can get the bonding they deserve in those first critical weeks and months. And mostly just hope that there are individuals and researchers working right now, right, who care to find answers for women and mothers who are fighting a battle. So now that we've covered what zuranolone is and why it's so different, we can also talk now about the bigger picture and the other medications in development and the hurdles that still stand in the way of getting treatment to every mother who needs and deserves it. Also, back to zuranolone before we leave it. Clinical trials found out that participants taking zuranolone showed significantly greater reductions in the HAM-D scores, which the HAM-D is a depression scale if you don't know. And they showed a greater reduction in scores compared to placebo. And many women, I may have mentioned, reported noticeable improvement as early as day 3, with benefits persisting through day 42, which is 4 weeks postpartum. And it is different because it functions as a neuroactive steroid that acts as a positive allosteric modulator at GABA A receptors, enhancing inhibitory signaling in the brain, which is a key pathway disrupted in postpartum depression. So that's how it's supposed to work. And developed as an orally bioavailable alternative to the IV neurosteroid brexanolone, zuranolone has a half-life of only about 16 to 23 hours. So that supports once daily dosing. Like we talked, once daily for 14 days. So the key takeaways are people felt better often within just 3 days, and improvements lasted weeks after completing the 2-week course. There were population limitations in the studies as well, such as trials exclusively included women with severe postpartum depression and did not include individuals who were breastfeeding, leaving that gap in understanding how Zurzuvae might impact the group, or it didn't allow us a chance to see the long-term outcomes. Nonetheless, FDA approval did come in August 2023, granting zuranolone priority review and designation as the first oral fast-acting treatment for PPD. However, its application for treating major depressive disorder was denied in the same round of decisions. Back in 2019, brexanolone taught us something important. Postpartum depression could respond to a completely different kind of treatment. Not the old serotonin drugs, but a hormone-based approach. The problem was access. Let's zoom out for a second, because zuranolone and Zurzuvae are a huge step forward, but it's not the only option on the horizon. To understand where we're going, we need to remember where we started. So what's next? Oral brexanolone. Oral brexanolone, because researchers are working on an oral version of it, of the IV brexanolone, basically taking what worked in the IV and making it into a pill. A pivotal study found, or a study showed that the oral formulation behaved the same way in the body as the IV infusion behaved. The company behind it is pushing for FDA approval, and if it is successful, it could make that same powerful effect available without the hospital stay, which is really exciting. But of course, there is still always the issue of accessibility. It's a really big deal. If you're in healthcare, if you know, you know. Another option, another exciting option on the horizon, another treatment is levocetirizine, which is another experimental drug in the pipeline, which is a psychedelic prodrug, now in phase 2 trials. It's cool because it acts on serotonin receptors and is being tested for its ability to bring about rapid, durable antidepressant effects. It's in its early days, and no one's saying this will be in your local pharmacy. So here's the takeaway. We're finally seeing new medications for postpartum depression that work faster, more directly, and more effectively than anything we've ever had or seen before. That's the hope. But the reality is the work isn't finished until every mother who needs them can actually get them. Postpartum depression is not a weakness. It's not a failure. It's a medical condition, and every mother deserves treatment that works. A chance to feel connected to her baby, and the chance to heal from wounds that may already have been caused. The work isn't finished until every mother who needs them can actually get them. And while none of this changes the pain of the women who came before us, the ones who suffered silently, misunderstood, and without real support or options, it does mean we have a chance to change the future. To make sure the next generation of mothers doesn't have to carry that same weight. And that's what the work in front of us looks like. And it's work worth doing. Thank you for being here. And we'll be back soon with some more mental health topics. If you like today's episode, please like and subscribe. And we'll be back soon to talk about some more topics.